Hello, Mr. Batman.
Hello.
My name is Jake Sapella, and I'm an NKU nursing student. I'm here to talk to you about all of this craziness going on with the transmission and infection of COVID 19, or as you may have heard it, as the coronavirus.
Oh, that's fantastic. I have a ton of questions for you. And especially now, since my family and I have been kicked out of our mansion. We no longer have a place to live.
I can understand you might be feeling some anxiety, and hopefully, after today's conversation, I can alleviate some of that anxiety for you. There are 4 things I'd like to go over today with you, Mr. Batman. The first thing I'd like to go over with you is self-protection from the coronavirus, how to protect yourself from getting infected. Then, I would like to go over the signs and symptoms of the coronavirus. Then I'd like to go over what to do when or if you become sick. And finally, I'd like to talk about social distancing, what it means, and how it could benefit you.
All 4 of those topics sound fantastic. I love that idea.
Good, let's go ahead and get into self-protection. As you can see on this first handout, Mr. Batman, I'm going to go over 4 great ways to protect yourself from coronavirus. First great way is to wash your hands often with soap and water for at least 20 seconds. Great way to tell how long 20 seconds has gone by? Count your ABCs twice. Happy birthday. Twinkle, twinkle, little star. You get the drift. Or just count to 20. Next thing would be to put distance between yourself and other people. Especially here in Kentucky, we want to make sure we keep our distance.
Is that why you're standing so far away from me right now?
Exactly. We should probably maintain a safe distance of about 6 feet away from each other. The next thing would be to avoid touching your eyes, nose, and mouth.
I don't have a problem with that, because I'm already wearing a mask. It's very hard for me to touch my face.
Very good. You should avoid touching your face, and your mask definitely helps do so. But finally, the last thing I'd like you to do is to cover your mouth and nose with a cloth whenever you're around other people. The next thing I'd like to go over with you, Mr. Batman, is the concept of social distancing.
Yeah, I've been hearing that around lately. What does that mean?
What that means is we essentially just want to stay away from each other, because that is the main way this virus is spread, is through person-to-person contact. So as long as we keep a safe distance, about 6 feet apart, we can ensure the safety of the people around us, like the ones we love.
Like Alfred.
Exactly. Just like Alfred.
Jake, I do have a question for you.
Go ahead, Mr. Batman.
If I do get sick with coronavirus, what does that look like?
Well, Mr. Batman, I'm glad you asked. Here, take this next fact sheet I'm about to hand you.
Oh, that's a super interesting signs and symptoms fact sheet.
Yeah, let me break it down for you. Essentially, the symptoms of coronavirus include a fever, coughing, and shortness of breath or chest pain. So if you're experiencing any of these symptoms, you should probably think about calling your case manager or a healthcare provider that is near us.
Oh, that is good to know.
Can you repeat those symptoms back to me?
Sure. If I have a fever, cough, or if my chest hurts, I should probably call someone to get help.
Very good. Now, the last piece of paper I handed to you was what to do when sick.
That was the next question I had for you. If I do get sick with corona, what should I do?
Well, the first thing you should probably do is get rest and stay hydrated. And monitor how you're feeling. If you start to get more sick, you should definitely call emergency services. Call 911 and let them know you have or might have COVID-19. The next thing you can do is to keep others from getting sick. Separate yourself from everyone. Make sure you stay separated from 3 days to at least 1 week since your symptoms have started. In summary, just stay hydrated, make sure you're not getting any worse, and keep yourself away from other people.
Those are all really good points. Thank you.
Well, Mr. Batman, that is all I have for you today.
Oh, Jake, thanks you for taking your time out of your day and helping me.
One more thing before I go. Could you quickly demonstrate how to wash your hands and cough into your elbow for me quickly?
Sure. I'll wash my hands for 20 seconds. Easy way to do that is to sing happy birthday. Coughing into my elbow and sneezing into my elbow is a great way from preventing droplets from getting out of my system and into someone else's.
Very good. Now, with the other 3 pieces of paper I gave you, make sure you spread this information to others around. This isn't only for you, this is for everyone. Remember, we're in this together.
Thank you, Jake.
Thank you for listening, Mr. Batman.
Hi, Tank and Luna. My name's Casey. I'm a nursing student in NKU, and I'm just here to tell you all about some of the changes you may see concerning COVID-19 with community shelters and housing, as well as some opportunities for local testing should you think you have any symptoms. So I gave you some papers at the beginning of this discussion that have a map of Covington with highlighted areas that provide shelter, as well as a list of phone numbers and addresses. But I want to start with local testing. I know a lot of people think that you can really only be tested for COVID at a healthcare facility. However, some pharmacies and locations within Covington are testing for COVID. If you feel at all confused about where to go or who to get into contact with, make sure to contact your case manager or go to a shelter and speak with a community health provider. They can put you in contact with a testing center. But if you do think you need to be tested for COVID, make sure that you maintain proper social distance, so 6 feet or more from other individuals, and wear a mask anytime you're around others in public. So it's also important to update all of your personal information with your case manager or whoever your community healthcare provider is, just in case you do become ill with COVID. And I would advise you to put down an emergency contact as well, just in case. And if you decide to stay within an encampment, or if you're staying in a shelter, you should expect for shelters to have lower capacities at the moment due to COVID and the need for social distancing. So it may be hard to find a place to stay. There are overflow facilities available, and again, if you speak with a representative at a shelter or your case manager, they can put you in contact with someone who can get you a place at, let's say, like a hotel right now, just in case. And then if you decide to stay in an encampment, I'm not sure what your living situation is, it is important to maintain social distancing within the encampment. So the CDC is recommending that all sleeping quarters, whether it be a tent or something else, be a 12 by 12 space per person, just to prevent any kind of infection spread. And also be sure to really comply with hygiene right now, covering your cough with your elbow or in your elbow, or proper hand hygiene, as well as sanitation. If the encampment isn't near any public facilities for restrooms, you can let your case manager know, and the state is going to provide portable latrines, as well as hand washing stations should you need it. There will be soap provided, hand sanitizer, and other products that'll just help you prevent the spread. Also, if you need a mask, they can provide you with a mask, or even just a bandana or something to cover your mouth and your nose. And again, if you have any questions or anything, you're just welcome to contact any of the community health providers, and they can put you in contact with anyone else. So some of the emergency shelters in the area include the Emergency Cold Shelter of Northern Kentucky, the Welcome House at King's Crossing, Homeward Bound Shelter, Fairhaven Rescue Mission, the Women's Crisis Center, Gardens at Green Up, which is a child development center and homeless shelter, as well as the Brighton Center, and that one's in Newport, but it's just across the river. And again, just, if you have any questions, let me know.